Hi, welcome to Dr. Dale's Life Issues. I'm Dr. Dale Atkins. Join me as we talk about circumcision. We need to find out what it is, when you do it, if you do it, and what's the discussion that you have with your spouse, with your parents, with your rabbi, with your doctor. This is something that a lot of couples are talking about these days, and join us as we talk about the issue of circumcision with people who are deciding or have decided whether or not to circumcise their sons. One of my guests is Dr. Sam Cunin. You are a board-certified urologist and a moil.
That's right.
And you perform circumcisions for lots and lots of young couples. What is the most outstanding feature of a circumcision? When you go to a couple and you talk to them, you counsel them, what do you think their biggest concern is?
I think for the most part it's the unknown, but there are some knowns that people certainly can understand. Being surgery, everybody can relate to the possibility of the issue of pain. And I think in contemporary times that has been the one area that has probably been addressed more so than ever before.
Do you think rightly?
Absolutely.
Yeah, because this is really a concern. People are very concerned about whether or not the child feels pain. Does the baby feel pain?
Yes, it certainly does.
Okay, so we have that on the table right now. Julie, I want to go to you. You are working in birthing and birth education. You're very involved in teaching people about what's involved with birthing. You also have children, and you've kind of changed your view about this back and forth. Can you share with us some of your feeling over the year, how you've changed?
Yes, I'd be glad to. I teach childbirth education, and I like to think that I give people information so they can make a decision of their own of whether they want to circumcise their child or not. And I don't think there's a right or wrong. I think it's very personal, but I think it's important for them to have information on both sides. Myself, I had my child 25 years ago, and I had a really nice birth experience, and I said to the doctor, when do we circumcise him? And the doctor said, do you know that you don't have to circumcise him? And I said, no, I didn't know that. And he said, here's some information, and go ahead and read this information, and if you want to do it, I'll do it in 3 weeks. And I feel adamant about not doing it before that, so that if you have breastfeeding situations or if the baby gets jaundice, that you can work through those things and then have the circumcision. And my husband and I went home and we read the information and talked a lot about it and decided that we would let this be our son's decision of whether he wanted to be circumcised or not. And we chose not to circumcise our son. And I am Jewish, and it made it kind of a difficult decision, and my parents were very upset about it, and that was a difficult issue to work through. Lots of years have passed by, so I have 2 sons, and they're both not circumcised, and I still feel good about that decision, and I also respect people who choose something different than that.
Mm-hmm. Michael, you just recently had a baby 4.5 months ago, and I believe Dr. Cunin was the person who circumcised your son. Was this an issue for you and Christine as you were contemplating the birth of your son and whether or not you'd circumcise him?
Yes, it was an issue for both of us, in as much as the fact that we're married, and an issue for one of us is to some degree an issue for both of us. I personally really had no doubts, no question as to whether or not that was my preference. And the only sort of hesitation, doubts, discussion, debate that we had were basically, prompted by my wife, who, had to deal with some issues and some personal feelings about it.
Let me go to her. Christine, what were some of those issues and personal feelings that you had?
I'm Jewish by conversion, and I converted about 2 months before my son was born. And so the issue of medical circumcision was something that was sort of a little more comfortable for me, and the issue of a ritual circumcision was very sort of foreign to me, and because I didn't grow up in that faith, and I had never been exposed to it. But I found that once I converted, I fully embraced Judaism and all the practices, and I decided that I was comfortable with that, as comfortable as I could be, and it was something that I wanted to do. And I had some apprehension about any pain that my son might feel. And I was able to overcome that and come through it.
Rabbi Neil Comas-Daniels, you're here with us. You counsel many couples, and this is not a new issue for you.
No.
What do most couples, when they come to you and they ask you about circumcision, what is foremost on their mind?
What's foremost on their mind is what's been spoken of already, which is the issue of the child's discomfort, their discomfort with their child's situation. And to be honest, as a rabbi, I don't have the expertise to respond to that. And I tell them that, and I often refer them to Dr. Cunin or to other Moalim that I know, or Moalot that I know, and get them some advice in that way. But I do take the opportunity to begin to talk about the spiritual dimension.
Please,
and
talk
the fact
about
that this is a covenantal ceremony, which is something that often gets overlooked, and that the circumcision itself is supposed to be not just merely significant in terms of it being a covenantal toggle switch, as it were, that makes this child a bona fide Jew. But it goes beyond significance. It's supposed to be symbolic, and symbolism is something that you can only emote. You can't even talk about it. And so I try and touch that place to see what's there, to see whether or not we're ready to have indeed a covenantal ceremony, and that in some ways actually often balances out some of the discomfort. And at other times, I found that it overwhelms the discomfort about circumcision. And sometimes it actually can be isolated so that some people can see circumcision as a physical surgery, as Dr. Cunin talked about, and the covenantal relationship completely differently.
I see. Catherine, you and Mark have faced this issue. What were some of the concerns that you had or have? You are also an expert in birthing, and are you not a midwife?
I'm not a midwife. I'm a doula, certified
Okay.
doula. I was studying to be a midwife.
Yes.
But yeah, when we found out we were having a son, we'd gone for an ultrasound, and we called up my mother-in-law, and the first words out of her mouth is, "There's going to be a bris," and I went, "A bris?" It's like, and I hadn't even thought of it before, and we went through a lot of changes about it, because I agree that there's no medical reason to do it. That a boy can be taught to keep the foreskin clean, and that the discussion about cervical cancer and things like that, and it's but we made a choice to have this ceremony as Jews, and that it was a covenant, and we were going to make our son Jewish, and that this was bringing him into our tribe.
Mark, were you together on this?
We were, and the covenantal relationship was finally the most compelling one, actually. We weren't persuaded at all by medical arguments at this point that it was a physical necessity from that standpoint. But we discussed it for, I think, twofold. I mean, the adult world always assumes it can blithely impose itself on children, and our whole society is set up that way, and we were going to be irrevocably physically marking him, so we had to really understand between ourselves what that meant and why we were doing it. And even insofar as it's a covenantal relationship, and we're inheritors of this tradition. I mean, there are other things we choose not to do, like stone adulterers and lock lepers outside the gates of the city. So, I mean, even that, you still pause and think about where the tradition is coming from, and then why we are choosing to take this particular step.
Another one of our guests has chosen not to take this step. Sharon, you chose not to have Shane circumcised when he was born 21 years ago.
Yes.
What impacted that decision for you?
Well, firstly, it was my ex-husband's idea, and he was raised Jewish. We were both raised Jewish, and he had been circumcised, and somehow he always felt that his sexuality had been diminished, that he had been robbed of something, you know, and since I wasn't the one with the penis, you know, I had to listen to what he had to say, but I didn't stop there. I went and I spoke to a urologist. I spoke to a pediatrician. I spoke to 3 doctors, and based on, I was looking for some reason to do it. I was looking for someone to give me some sort of hygienic or medical reason to do it. And as far as I was concerned, if the child was born with it, there was a reason for it. It had a purpose, just like all parts of the body. And I was into natural childbirth and birth without violence, and I was breastfeeding, and it just seemed inconsistent with all of my ideology.
Shane, you consider yourself Jewish. You had a bar mitzvah. Has this ever caused you to feel in any way less Jewish?
Not at all. At times, I think during my bar mitzvah, there had been a mention maybe of a bris and things like that, and we kind of just didn't pay attention to it because it's just something that they had expected had been done, and I just didn't really address the subject because I didn't think it was necessary. I spoke to my father regarding the situation. He's had actual problems because of it. Maybe the doctor did a bad job or something, but I just don't feel like it's necessary in any way or form. So I don't believe any surgery that's unnecessary should be done to anyone.
While we're on the subject of surgery, I want to go to you, Helen. I know that many years ago you had your son circumcised when you were in Germany.
That is correct.
And with it,
Oh, it was...
you almost lost your son.
When he was 2.5 months old, he was only 8.5 pounds. They said that was good enough. I was told that the pain would be minimal, but the moil said his foreskin was really large. Well, for a 2.5-month-old baby, it would be. He should have known better. I didn't know until later that the blood count drops at about 2.5 months. And when we took him home after the circumcision, it wasn't but an hour or two we were home, and my son suffered terribly, screaming bloody murder, and they never told me that it would hurt that bad. Even giving him as many sips of wine as you could count, it didn't matter. I took it home. His eyes were glassy. He was just looking straight ahead, staring like he was out of it. I was upset, and I thought, I'm going to go upstairs and get this American RN who lives there to look at him. No sooner did she pull the diaper off, it was totally blood-soaked. She says, you've got to get the doctor. This child is sick.
So you and Dad went, and as I understood it, had to have him transfused. And this is probably one of the worst stories. I want to go to Dr. Cunin because you are here both as a doctor and as a moil. I heard you making comments as some of the people were talking. The issue that Helen suffered when she was in Germany, how usual, how unusual? She almost lost her baby.
That's right. And that's an unfortunate situation. And yet I don't think, when you consider the numbers of circumcisions that have been done, if they're done properly, this is an untoward effect that usually will not happen.
So we
the
can
fact is
assume
we have a
this
2.5-month-old baby
Yeah.
versus a newborn or an 8-day-old baby in the Jewish tradition. And this
Some
is
comments were made about hygiene, and some comments were made about care for the penis and whether or not it is healthful to not circumcise a child. I'm not talking about the covenantal aspect right now. I'm talking about the health aspects. Is it healthy, is it okay, health-wise, to have an uncircumcised penis?
For some men, yes, and for many, no. It's as plain and simple as that. I think.
What does it depend on?
Well, it depends on the makeup of the foreskin, the person's personal hygiene, and what have you. You've addressed, there have been many things that have been addressed regarding circumcision here, and let me, if I may, I'd just like to spend a few moments. I mean, I would not stop I think your 2.5-month-old child should have had local anesthetic, and this has become a standard for circumcisions today, and they don't have to be painful, and there are people in this room that will tell you that their babies virtually probably cry more at a diaper change with proper anesthetic. Having said that, that circumcision on a 2.5-month-old baby should have been done by a physician, not a moil, and it should have been done, and stitches should have been placed. So that was a matter of technique, and that was a poor choice. I don't think we should throw out the baby with the bathwater and throw out Brittany law and circumcision on the basis of that experience. I think that if you look at there's a lot of conflicting literature, but not within the mainstream medical literature. the American Academy of Pediatrics got together, and they have changed their policies from 1972 through 1989, and the mainstream literature today primarily says that circumcision may have health benefits, and therefore you should discuss them with a physician who can give you both sides of the coin, and then make a decision. I think the best somebody mentioned cervical cancer. In 1972, the American Academy of Pediatrics said cervical cancer and circumcision, there's no connection. And of course, what happened later on is we found out that, first of all, circumcised children, for the most part, circumcised men have very frequently will get sexually transmitted diseases that will not be seen, particularly special types of venereal warts. They can give them to a woman, and years later, if she has certain types of serotypes of these warts, very special types, they do create cervical erosion, and they are the cause of cervical cancer.
Let me interrupt you for a minute. I also want to go over to Steve, who's sitting there. You recently had a baby, and who's in the back. And how did you come to this decision as far as circumcision or not circumcision?
The fact is that I was circumcised, and it happens to be one of those rituals in Judaism that means something to me.
Mm-hmm. Catherine, you talked before about the decision and how you were able to enjoy, even though from afar, the experience of having your son circumcised.
Well,
and I don't mean at the very
enjoy
moment.
it.
I certainly don't mean at that moment, but that this was a meaningful experience judaically, and it meant something to you.
Yeah.
Do you think children should be allowed to come to circumcisions and to watch?
Oh, absolutely,
Mhm.
absolutely.
Mhm.
Yeah, they're just as much a part of the community, and it's a communal event. I mean, that's the main point of it, in my opinion, really.
Rabbi,
Yeah.
do you encourage families to bring all of the children and to have people there of all different ages?
Absolutely, but it really depends on the comfort level of the couple. You
Because
know,
so many
Yeah.
people don't know, and especially if the mother is feeling as if she just can't witness this, sometimes kids get so scared, and I think that families need to talk about this prior to, yes?
Right. It needs to be put in their lap rather than said, well, this is what's normally done, so do it. That's my whole approach to the whole thing. I really try and broaden it. May I speak to some of the things
Please.
that have happened already that we've spoken about? It's going to sound strange. Well, first I want to preface this by saying that I'm a Reform rabbi, so that some of the things that I can speak about and do speak about have to do with Reform responses and Reform attitudes. I understand the idea of mitzvah, that this is a mandate, a commandment. From an Orthodox perspective, we wouldn't even really be having parts of this discussion. And I think that's important for everybody to acknowledge. On the other hand, I need to talk about little girls for a second.
Please.
The Reform movement and the Conservative movement both encourage a brit ceremony, a covenantal ceremony with a little girl. In fact, the Reform ceremony is designed to be on the 8th day, the same way it would be for a little boy. Part of what that does is it begins to raise the kinds of questions that we haven't asked before, like if a little girl is welcomed into the covenant of the Jewish people equally to a little boy without a surgery, why do we do the surgery for the boy? Meaning that I understand it historically, I understand the mitzvah, I understand the covenant that was made with Abraham and so on and so forth, and how it was followed through. But it speaks to the very heart of the matter when we say, well, what is this about? This is not really about the baby. This is about the parents, and whether or not the parents are committed to raising their child as a Jew, and whether or not this ceremony is going to impact them to be indelible in that kind of way. Obviously, psychosocially, one of the things that circumcision provides is the kind of experience that you don't forget. I think everybody here who's witnessed their own child being circumcised, you won't forget it. The question is, can we have an experience that you won't forget without a surgery? We
And
certainly
this
do it
is
for
what,
girls.
when you talked to me on the phone, you talked about a bloodless circumcision, and this is what you're referring to.
Yeah, well, it was a bloodless bris,
Yes.
in other words, right?
Yes.
So that this particular couple we talked about all of these issues, and they were so adamant about their I wouldn't say they were opposed to circumcision. I would just say they were really frightened. They were very, very uncomfortable with issues of pain. At that point, issues of anesthesia were not brought up. None of the Moyles that they spoke with were comfortable using it. It was an earlier time. We talked about the fact that maybe they would do it later, but at this particular moment, they wanted to have on the 8th day
A ceremony.
a ceremony,
Yes.
and I was there. I did it.
Christine, I want to go back to you for a second. Your family of origin is not Jewish.
Right.
What was their response when you had them at the bris? Were they at the bris?
My mother was at the bris.
Yes.
My father was not. My mother she's Christian, and she's particularly uncomfortable with medical procedures, and but she did come to the bris, and she came up to Michael in the middle of the ceremony, and immediately after the actual procedure was done, and she said, "Michael, when is the doctor going to do it?" Because she was so nervous, she was anticipating screaming and crying. And Michael said, "It's already been done." And she said, "Oh!" You know, she couldn't believe it because there was no way to tell from the baby's reaction whether it had been done or not.
And why was that?
Probably the skill of the person that did it, and also probably the anesthetic.
Which was what?
The baby gets some credit. Okay. We give the baby, interesting, we give him sugar water with just a little wine. The wine is because everybody expects the red color, but the fact is the sugar is the important ingredient. Sugar actually releases something called endorphins, which give us runner's high, and a baby is sedative. And we start the baby sucking on that before I do it. And I gave the baby a tiny little block with lidocaine anesthetic, which was only in the skin that came off. So once the circumcision was done, the baby had no more anesthetic in him, and he hardly whimpered. I mean, I'm sure you've had harder diaper changes. And there's no reason why the baby has to suffer any pain. And the point is, you can do relatively painless circumcisions today, and why not?
Even though it's a painless circumcision, the healing is not painless.
Yes.
And when the child urinates and the diaper is not changed immediately, it is uncomfortable. And people have to recognize that there is some uncomfortableness associated with circumcision. And that doesn't mean you shouldn't or should circumcise, but they need to recognize it is not all painless.
And I think that the point that you make, and from what I understand from talking to you on the phone, what you try to get across in your classes is to give as much information as people need to make an important decision such as this, and to have the information they need so that they can really evaluate all aspects of it, both pre and post the circumcision.
That's correct, and I try and encourage them to circumcise on the 8th day and not earlier, whether they're Jewish or not, because the blood clotting factor is stronger, and they've gone through either getting jaundice or not getting jaundice, breastfeeding situations, and all that has been experienced and hopefully handled. And then they can enter into circumcision and be a little more peaceful about it than when it's done on the first day. Plus, not circumcising in the hospital, I think, is an advantage. Even though the doctors that I work with, I think, do an excellent job, that circumcision in the hospital, there's a lot of bacteria in the hospital, and sometimes babies get staph infections.
Sharon, I want to go back to you. You mentioned before that when I spoke with you on the phone that you would make this choice again, and I think, Shane, you agree with that. If you're advising people, if you have a friend who's pregnant or whatever, what would you advise them if they came to you for advice?
Well, as I said before, you know, I think that there's a reason for the foreskin. I don't think that you're born with a body part that doesn't have a purpose. And also, I feel that that it isn't really our decision.
There are so many issues that have to do with circumcision. As you said before, Rabbi, we wouldn't be having this discussion if we were all Orthodox. We would just be going ahead, which is not to say that Orthodox women do not feel the pain of their children or do not have questions about
Orthodox men, I think it's for
Yes,
all.
Of course.
yes, thank you. But I do thank you very much for talking about your different perceptions and your different experiences with circumcision and sharing them so that people who are watching can also get a sense of what's involved in the decision and where they might be able to get more information about it. So I thank you very much for being here, and I thank you too for watching Dr. Dale's Life Issues, and we'll see you next time.
Dr. Dale's Life Issues is made possible by a gift from Culligan.